Humane recommends. Access humane.uk.net.
In this Humane Recommends we read a sample of the article, Inequalities Intensified by the Pandemic. COVID-19 has in some ways proved to be a great leveler for the world's nations, with the virus indifferent to the race, gender, sexuality, disability or social class of those it infects. It has, however, served to highlight many of the inequalities that exist both within societies and, indeed, within the NHS itself. Acknowledging and finding ways to address these inequalities was the subject of a frank panel discussion at this year's BMA annual representative meeting. The first national advisor for LGBT health, Dr. Brady said COVID had increased staff workloads and dramatically changed ways of working, something that has had a negative impact on the mental health and well-being of many health service staff. We know from the NHS staff survey that lesbian, gay and bisexual staff report worse experiences when compared to their heterosexual colleagues, are more than twice as likely to report bullying, harassment or discrimination in their workplace, he said. Systemic racism. Ms. Dada highlighted the killing of George Floyd, the African-American man who on the 25th of May died whilst being restrained by police, as a moment of immense grief and outrage, but also a turning point in demonstrating the need for global conversations about the corrosive impact of systemic racism. Looking to the future, I am hopeful, but I am not naive, and I know that we cannot afford to be complacent. Although we have been taking steps in the right direction, more still needs to be done, she said. Disabled people are forgotten. A call to action was one shared by Neurology Registrar Helen Grote, who spoke about how disabled patients and medical professionals had frequently been forgotten or ignored during the pandemic. Herself deaf, Dr. Grote has helped lead a campaign for the introduction of clear face masks in the NHS, something that she said was straightforward yet so important to improving the experiences of those with hearing loss. Religious inequality. London GP and Vice Chair of NHS Religion Equality Advisory Group, Mark Pickering raised the issue of religious inequality, highlighting it as one of the often under-discussed inequalities that exists within the health service. Dr. Pickering said discrimination relating to faith was also an issue that frequently intersected with ethnic and cultural inequalities, pointing to the conflict that had occurred during the pandemic around incompatibilities of PPE with certain aspects of religious identity. Resources available. Panel member Professor Farah Bhatti, a cardiac surgeon and chair of the Women in Surgery Forum at the Royal College of Surgeons of England, said she fully recognised the struggles that many doctors faced in being able to perform their job, while still not having to compromise their religious beliefs and expressions of faith. She said there were resources available, such as disposable sleeves for those who did not want to be bare below the elbow, and that religious clothing, such as the hijab, were perfectly acceptable within clinical environments provided that they were clean.
Did you like this recommendation? Hit the like button and read it in full by clicking on the link in this video description. All citations recommended here are solely for educational purposes. Our aim is to provide the community with access to the educational inclusive materials of excellency we come across. Yours included. If you hold the copyright of any video or article cited here, or you think they should not be available on our channel, please let us know and we'll remove them at your discretion.